Hello, my name is Debbie Boone, and I want to welcome you to my podcast, The Bend, where we explore how successful people navigated the path and emerged in a better place when life threw them an unexpected twist. It's inspired by one of my favorite sayings: the bend in the road is not the end of the road unless you fail to make the curve. These conversations will hopefully help you and inspire you to embrace your personal bend and to flourish. I hope you enjoy it, and if you need help with your own personal navigation and you're in veterinary medicine, please feel free to reach out to me at Debbie Boone 2 Manage Vets Consulting. Enjoy the bend and be inspired by our wonderful guest. Welcome. Well, good morning, everyone, and welcome to this episode of The Bend. Now, today I have a special guest, Dr. Kate Boatright, VMD. That's right. She's a Penn grad, so she is a veterinary medical doctor. She graduated from University of Pennsylvania in 2013 and has worked in rural small animal general practice and emergency clinics ever since. Her passion is about inciting positive change in the profession through mentorship and servant leadership. And in organized veterinary medicine, she is part of the AVMA House of Delegates. She's active in her local and state VMAs. And she is a former national officer of the VBMA. If you're not familiar with that, that is the Veterinary Business Management Association. That is a student-led and run organization in every vet school out there now. It started out, did it start at Penn? I think it might.
Yes. Yeah.
So you guys were the original chapter, and then everybody else picked it up and took off with it. So Kate, thanks for being here today. And thanks for all the things that you do for Vet Med.
Yeah, absolutely. Glad to be here.
So were you one of those kids who always wanted to be a vet? Was that your MO?
Yeah. I took a brief detour into oceanography, like around second grade. And then I learned about sharks and I was like, yeah, no, I'm good.
Well, I live at Myrtle Beach. So I always, there's two things that I think about when I get into the ocean: jellyfish, which is probably more likely to get me, and then the sharks, because with the climate changes, the sea has changed a little bit of the patterns, and we're seeing more sharks, which we never used to see, things like great whites. And a couple of weeks ago, we even had a whale. So this is not typically whale path here. So I'm getting a little oceanography, but it's staying from the shore. Because when you're in oceanography, you have to get in the water, right? Yeah.
I think so. Yeah.
Yeah, you do. Okay. So tell us, when you decided to be a veterinarian, how challenging was that? It's not the easiest profession to join.
Yeah. I mean, like you said, at 5 or maybe before, it's like, I'm going to be a vet. I had a lot of support from my family. My mom actually had wanted to be a vet when she was a kid and was discouraged from it because at that time it was a very male dominated profession. And she actually ended up going into ministry, which was at the time also a very male dominated profession. But one of the things she did when I was a kid was she made sure that all of the vets we took our family pets to were women, so that I could see women doing what I wanted to do. And so so that's what I grew up seeing. Went into, undergrad, stayed that path, got interested in research while I was in undergrad. I went to a really small liberal arts college in Ohio, Hiram College. And I actually spent every summer doing research projects there. I worked with bacteria for 2 summers, and then actually worked with capuchin monkeys doing behavioral research for a summer. And so, I was like, I still want to go to vet school. I kind of like the science. I briefly toyed with like the DVM PhD, but I knew I ultimately wanted to be in practice. And so I was like, what would I use a PhD for in practice?
Mm-hmm.
I don't want research to be my primary area. So started vet school. I intended to be a surgeon and a practice owner, was what my plan was entering school. About second year, I hit that like student burnout of like, I do not want to keep doing this. This is insane. And I was like, oh, I don't know if I want to do that, like internship, residency. But I also was finding like I liked so many different aspects of the profession. Like I was like, well, I like neurology too, and I like internal medicine, and I like emergency, and finally kind of settled on the fact that like if as a general practitioner, I can do a little bit of all of that.
Yeah.
So I ended up going straight into GP out of school, definitely in the minority in my class, graduating class of not doing an internship. And I loved it. I have no regrets of taking that path. Um, I got very involved because I thought I wanted to own a practice. I got very involved with the VBMA when I was in school. And that has really had some long lasting ripples on my career. And then as I got into practice, absolutely loved it. Started mentoring, went through a few different practices. And as I did that, I realized like I did enjoy practice. I love connecting with clients and working with my team, but I wanted to do a little bit more. And so I started doing writing and speaking as just kind of a little side hustle. And within a few years, I got to the point where I hit burnout in practice. And so as I was evaluating that, I realized that I wanted to do more of the writing and speaking, and the opportunity was there. So in 2021, I started my LLC and moved to part-time clinical practice and have been attempting to balance the two of those ever since. Some days are better than others on the balance side, but just kind of enjoy having the flexibility to to do and the support of the practice that I work in as an associate to be able to take some extra time off for conferences and
Mhm.
things like that.
Yeah. Now, when I think about you, Kate, I think about two things. I think about mentorship and I think about spectrum of care. And maybe they
Mhm.
overlap each other a significant amount because I think that they do. But kind of what brought you to the point of saying this is really a gap in practice? Because that I think that internship is where people, when they finish vet school, they think, oh, this is where I'm going to get that mentorship. And in my experience, which is long at this point in the game, a lot of times that's not what happens. They just became kind of cheap paid labor, and are not really coached the way they think that they should be coached or that they anticipated that they would be coached.
Mhm.
Is that kind of what made you think about mentorship as part of your contribution to vet med?
Yeah, I mean, I think there were kind of a lot of pieces to that. I mean, one of them was definitely like when I was in school, the mentorship internship debate was huge. And that was when like I was in school when the initial AHA mentoring guidelines were written. So it was a very big conversation, like all throughout my training. And not that it still isn't, but I feel like mentorship was kind of just becoming a more formalized idea at
Mhm.
that point in time. I was very fortunate that the first practice I worked in offered like what an amazing experience. It was not as formalized as a lot of programs are now. It was not as formalized even as what I teach and what I've offered to new grads, but it worked for me. And and then when I left that practice, that was my husband and I were working and living 3 hours apart. So loved the practice, but ended up leaving after a year just for sustainability of the rest of my life.
Mhm.
And didn't realize how good I had it until it wasn't there anymore.
Uh-huh.
The second practice that I worked at was not the best experience. Stayed longer than I probably should have. Um, and so kind of like, had pretty good confidence coming out of school and really built that up in my first year. And then it kind of tanked in my second job. And then I moved into a GP ER clinic. And kind of they were able to help me build that back up. And so just kind of seeing the different ways that mentorship was approached, how it was done well, what was lacking. And then as I started talking to, other veterinarians and other new grads and looking at the landscape, as I realized like, I love mentoring and I love working with students, but there are a lot of organizations that do that now.
Mhm.
We've got lots of national mentorship programs that provide fantastic support, but and I looked and I said, look, we're telling all of these practices, if you want to hire a new grad, if you want to keep them, you need to offer mentorship and you need to do it well. But no one's actually telling anybody how to do that.
Yes.
And so that was the gap that
Yeah.
I saw, was providing support for the mentors, and supporting new grads in that way of saying, hey, I'm going to help teach the people who are doing the mentoring and support them so that the new grads get the experience, because
Yeah.
I can only mentor so many new grads at
Right.
once. But if I train mentors, then I'm reaching more new grads that
Yes.
way.
Yes. Yes. I feel the same way about myself, because people talk about managing practices and why don't you
Mm-hmm.
get manage a practice? And like, because I could teach managers to manage practices and spread the knowledge out to a lot more practices and impact the profession more than if I'm just running a group or a one or two practices.
Mm-hmm.
So, but I think the point that you made is nobody really taught you how to be a mentor. And I was like you, the practice I started working in had a brilliant veterinarian who was not only a great veterinarian, but a very good business person. And that combination is rare in veterinary
Mm-hmm.
medicine. Of course, I grew up in business, so I kind of fell right into the right spot. But the mentorship of managers by practice owners is important, because a lot of times it's just a really great tech and they stick them in and go, here, now manage the hospital. And she's like, okay, I'm gonna do the best I can. And then they're upset with them because they didn't do a very good job. And I think it's the same thing with our new grads. I mean, we bring them out and we say, okay, you have your degree. And I have actually had new grads who come to me after they quit their first job and say, I was there 2 weeks and my practice owner left me in the practice by myself to, you know, sink or swim. And I'm thinking, what a horrible thing for you, but what a horrible thing for your patients too, to
Yeah.
be there with someone who was that green. And I was like, oh my gosh. But, in our hospital, we hired new graduates. And the reason we hired new graduates is because we didn't want to fix bad habits. And we
Mm-hmm.
wanted to, kind of teach them the way that we wanted them to go. And over the years, I have to say it worked out really well, because of those that we hired, 9 of them own their own practices and successfully run their own practices. So it's all in how you grow the people.
Mm-hmm.
Now, the and I actually was a member of Vet Partners when we built the mentorship guidelines, and
Mm-hmm.
it was an incredible document, and I just don't think enough people knew about it. And then it was a little old school because you couldn't change it rapidly.
Right.
That was the other problem with it too. But so tell me a little bit about the process of you working with mentors and teaching them how to, look after their mentees.
Yeah, so I mean, a lot of it has kind of come from just, my own, like started with my own experience of, I've done a lot of mentoring, of vet students and pre-vet students. And then, as I got more experience in the clinic, taking new grads on, and again, what worked and what didn't work as a mentee for me, and said, hey, like, this is what I wish these clinics would have known. And so I kind of started there. So I wrote the veterinary mentorship manual in 2023. So that's a self-published ebook that's available that kind of lays out just, tips for mentorship and just structuring a mentorship program. We have a lot of the big corporate hospitals have these very formalized mentorship programs, which is fantastic. But when I look at private independent practices, they don't have that big resource.
Mhm.
And so that's where kind of the idea of the manual was created. And it's been used by both corporate and private practices. But I wanted to give private practices kind of a blueprint of, like, if you're going to create a mentorship program, here are some of the things to think about. Here's the roles and responsibilities of the mentor, the mentee, the clinic management, because you have a role in this too. And then, kind of, how do you write a mentorship agreement? How do you schedule the new graduate? and progress them through that. I talk about feedback. I talk about some of the team aspects. And so I put that together. And then I started doing a little bit of consulting for some practice groups of just saying like, hey, let me see the resources you have. I'll give you my suggestions. And then just working with the mentors, both in providing just, virtual training, but then also just some like small group discussions and facilitating that and saying, where are you struggling? Like, what are, let's share some of the experiences. And what came out of that was, one, just getting to hear from the mentors of, hey, here's these common threads of things that, that mentors are struggling with, and want help learning how to support their new grads with. But also it allowed mentors to connect and say, yeah, I've dealt with that situation too. Here's how I did it. And so that was a really great, opportunity to learn more about, the wider landscape, and, kind of identify some of those pain points.
Yeah.
And one of those pain points is working and teaching that spectrum of care, which, as you said, that's my other passion area. And it was a passion area of mine even before. I think actually it probably came first. And then, but I really have found there's so much overlap between the two, because really they are about, helping. I think the bottom line is it's about helping our young professionals create a sustainable career.
Yes.
I love the vet profession, and I hate it when I hear people like, oh, I would never do this again. I would never recommend this profession. I'm like, why? It's
Right.
amazing.
It is.
But I understand where that comes
Mm.
from too. Like I've been through burnout. I get it. But I think, if we can set good foundations, we give people the tools they need. We can find so much joy in what we do.
Yeah. For those in the audience who may not be familiar with the term spectrum of care, for me, I look at it and like, this is what my vets always did.
Mhm.
It's let's figure it out. And yes, there's gold standard, but then there's also maybe some more practical ways to approach something. And I feel like there's a lot of fear, especially in new graduates, that they're going to make a misstep by
Mhm.
not offering everything that they can throw at a problem. And a lot of times, the older veterinarians who have seen cases come through are more apt to go, you know what, I know what this is. And I'll have to say, even for myself, just because I've been in the periphery for 40 years, so many times I hear a few symptoms and go, you know what, I think this is what it is. And I'll even be right. So
Mhm.
there's some just practical knowledge you pick up by osmosis if you're in it for a long
Yeah.
time. Um, what is your biggest hurdle to teaching spectrum of care?
Yeah, so I mean, some of it has shifted over time. As you said, it is not a new way to practice. People have been doing this for ages. But the term spectrum of care was introduced in like 2018. I started lecturing to students about spectrum of care in 2019. And the reason I picked that topic is because, I was just getting into speaking, and I wanted to provide students with something that I said, like I thought back on my career and I said, okay, what do I wish someone had talked to me about when I was in vet school? And especially working in a rural area, my first practice, we were 4 hours from a specialist.
Hmm.
Like even the clients who could afford to go to the specialist, when you told them how far they had to drive, they're like, I mean, I might go for one surgery, but I'm not doing all the follow up. Like, I'm
Right.
not going to go for multiple visits. And so I did a lot of primary case management on things that were much more complicated than I probably would have as a general practitioner in a city where specialty care was more accessible. And so I was definitely kind of brought into that spectrum of care mindset from the beginning of my career. And so I wanted to, kind of present to students, hey, like this is the reality. Like clients can't always afford all of the things that you're taught in school. And so how do you work with them, and how do we get comfort with that? And I remember when I first started giving that lecture, like I was talking to some of my colleagues about it, and one of my colleagues said, "Oh, the vet schools are going to hate you." They're like, the students will love you, but the schools are going to hate you that you're coming in and telling them like, hey, you don't have to do gold standard. And so, I mean, I think that was an initial hurdle, was just so many people were like, oh, like this is substandard. And, I can't believe that you're promoting this. Now I think that perception has mostly shifted. And I mean, AAVMC has a spectrum of care initiative, like it's being worked into the curriculum at a lot of schools, because we've recognized that if we're going to have a profession where clients can continue to afford care, if we can continue to treat our patients, we have to be flexible.
Mm-hmm.
Yeah, we have some amazing technological advances, but that's not accessible to everyone, and that's not what everyone wants.
Right.
And so I think now one of the bigger barriers that I'm seeing, with spectrum of care, I think when people think about spectrum of care, the first thing they think is client finances,
Mm-hmm.
and making that all the high budget option, the medium option, and the low cost option. But there's so much more to it than that.
Mm-hmm.
There's so many other client and patient factors that come in, and even factors I've seen, our vet teams and even us as individual veterinarians sometimes create barriers to care without realizing it.
Mm-hmm.
And so I think like that's kind of where I'm focusing currently, is, kind of getting that more collaborative team approach to spectrum of care, as well as just helping mentors learn how to support that. Because as you said, there is a lot of fear for new grads, especially around the liability aspect.
Yeah.
And the reality is that where we are as a profession now, you're more likely to get in trouble if you only offer gold standard and give no other option and the patient goes without care, than you are if you give a range of options and you explain and you document and you talk about the risks. Like you're probably going to be better off doing it that
Oh, yeah.
way. But it's how do we foster that mindset, especially if that's not how you were trained and what you were exposed to all through veterinary school.
Yeah. One of the things I've talked to a couple of friends of mine who were deans or former deans of veterinary schools, and my big gripe, and I have not been to veterinary school, I just have lived in this world for a long time, is that there is a lack of practical knowledge experience in the people who are teaching. And that's because they've never worked in the world of, like you, a rural practice, where the reality is people will not and cannot handle all the things.
Mm-hmm.
So it's all they know, and they teach what they know. And then the students come out expecting that that's what they will encounter. But I've often said, why is this so? And my ex-dean friend said when he was in veterinary school, every professor had at one point in their career worked in a practice in the public. And at this day and age, almost none of them have. And that's a problem because there's unrealistic expectations about what it's like to work with the public. And even people who come to the veterinary school for care are self-qualifying that they would even come there. So I laugh and say every year Banfield puts out a list of the top 10 things that people come to the veterinary hospital for cats and for dogs. And these are the things that we should be focusing on in veterinary school, because these are the things that you will encounter 80% of your day: ears, rears, skin, those kind of things. And then you would be more prepared. And then the other things are things that you have specialists for access to and can look up if needed, and call for advice on those other things. But you'd be much more prepared for practice. But that is my bandwagon case.
Yeah, I call it for my students, and when I talk to mentors, I call it the practical knowledge gap.
Yes.
Of, we have, amazingly intelligent students with tons of knowledge, but a lot of times they don't have the practical stuff, like you said. I mean, I can remember like in vet school, I got to scrub in on brain surgery on a cat. Like that was really cool. And
Sure.
it was cool to see. And it was like great that I got to, observe that and participate in it. But like, I'm never going to do that.
Ever.
And so, you know, I, but then the first time I saw an anal gland abscess in practice, I was getting ready to aspirate because I assumed it was a tumor
Uh-huh.
because that's what I saw.
Right.
And, when my mentor came in and she's like, what are you doing? And I'm asking her about, who does anal gland surgery and would we take out a tumor? And she's like, did you squeeze it? And I'm like, no, why would I squeeze it? It's clearly a tumor. It's an enlarged painful gland. And she's like, it's probably an abscess. You squeeze it first. And it was just something like, that's so basic and simple
It
when you
is.
think about it in general practice. Like,
Yeah.
I mean, I treat that if not daily, at least weekly.
Uh-huh.
But, as a new grad, did I learn that anal glands could get abscessed at some point? Maybe. I mean, I'm sure it was in at least, a subset of a slide somewhere, but did I retain that information? Not at all.
No, but yeah, ears and rears. That is what we
Yeah.
talk about every day, all day long. Yeah, I love where you're going with this because it is incredibly valuable that people understand a couple of things. And you mentioned this too. The spectrum of care is not just about what you're offering, it is also about paying attention to what the client can do.
Mhm.
I My mother's cat was diagnosed with diabetes, and she is severely arthritic in her hands. And my first thought was, how are you going to give insulin to this cat? Now, fortunately, the cat was incredibly chill cat, and she all would say, "Come and jump on the table," and he would jump up there, get his injection, and get a treat and move on. But what if she hadn't been able to do that? Then it would have been a completely different thing. And so I feel like the other part of the spectrum is what can the client physically do? What is the client able to do, willingly able to do? Because sometimes we have animals that need to be treated that you just can't do that, or the client can't do it. So you have to have another, kind of tool in your tool belt in order
Mhm.
to get the animal some care. And that comes with communicating with the client and paying
Yeah.
attention.
Yeah. It's all about finding out their story.
Mm-hmm.
It's about asking questions and then stopping and actually listening to what they're saying.
Yeah.
And I think too, it's about making that connection with them. Like I always say, like I attract complicated diabetic patients, like a moth to a flame. I own a complicated diabetic cat, and have been managing him for 5 years. And when I diagnose a diabetic, like one of the first things I say to clients is like, I want you to know I know how hard this is. Like I live with this on a daily basis, and I am not going to judge anyone who says, "Hey, I can't treat this." Whether that's finances, whether that's I travel for work all the time and I normally just have the 10-year-old who lives next door come over and throw some food in a bowl. Whatever that is, finding out and then, telling clients like it's okay to not treat this. It's okay. Like, but if we don't treat, this is what we need to expect. And these are the decisions you're gonna have to make probably in the near future.
Mm-hmm.
And so yeah, I do think, we can't just assume that the client is going to be on board with everything. And, I had one client a few years ago who she lived alone and we diagnosed her dog with diabetes, and she was all completely on board with treatment. The dog was not.
Mm-hmm.
And as hard as we tried to get him acclimated to getting injections, it did not work. And, after several weeks of trying, and we tried rewarding him and we tried all kinds of different things, like she finally said, like, every time he sees me, he's running away now. And so we had that conversation of, you know, I know, you love him and we don't want your final memories of him to be him being terrified. And so ultimately that was a case we decided that no treatment, was better. And, she ended up spending a little more time with him and then euthanizing.
Mm-hmm.
And, if I had said, oh no, you've got to figure this out, you've got to treat it, one, she would have been miserable. The dog would have been miserable. And two, I probably would have ultimately lost a client for the practice by doing that.
Mhm.
Because it's when it's the clients that we work with and that we get flexible and really connect with, that's how we bond them to the practice.
100%. Yeah, 100%. And of course, for my world of communication coaching, the connection is about everything. And
Mhm.
if we want compliant clients, and if we want clients that take good care of their pets because they're listening to our advice, then you've got to connect with people first. And I was talking to a veterinarian not too long ago, and I said the thing they won't teach you in vet school is that we are in the customer service business first, and
Mhm.
then we sell medicine. And when you look at it that way, it changes the perspective of how you work. And the first thing is connected with the human, because the human is the decision maker, and
Mhm.
then you have to collaborate with that person. So Kate, tell me about, looking at all the work that you've done, and when you started working in mentorship and spectrum of care. What is the thing you're the most proud of when you look back after all the effort you've put into it?
Yeah, I mean, there's a lot of things that, that I'm proud of. I I think like kind of most recently, I've gotten invited to contribute to some textbooks, both one on spectrum of care and one on mentorship. And for me, like, I mean, they're not out yet. One of those chapters may not be written yet and might be due in like a week. Um,
I feel your
but
pain. I've been there.
um, but like I think for me, like, it's just the fact of, being, being able to have that recognition of like, yes, like I am not a specialist. And I think in some ways for the things I do, I think, to be a specialist in these areas, you need to be a generalist.
Mhm.
There are some amazing specialist colleagues I have who have deep interest in spectrum of care, and I love collaborating with them. But I think like, just being able to raise awareness of that topic and have that association of, if you think Kate Boatright, you're thinking mentorship and spectrum of care. And I remember after one of my spectrum of care lectures a few years ago, it was one of the early times I had spoken at a conference for veterinarians about it instead of veterinary students. And there were just a handful of people in the room. I think attendance at those types of lectures has definitely grown in the past couple of years. But at the end of the lecture, one of the vets came up and to me and she said, "You know what?" She said, "I don't know if you realize how many thousands of pets you have impacted by talking about this." She said, "Because it's not just your patients that you're helping, it's all of our patients."
Mhm.
And that was one of those things that just really stuck with me.
Yeah. Oh, yeah. That's I just love it when things like that, and you speak at conferences, and you kind of hope somebody's listening and that it's sinking in, and then somebody will message you and go, "Yeah, like this message this changed everything about the way I think about things." And I think about when talking about spectrum of care, and you and like Emily Tincher Emily's been vocal about the spectrum of
Mhm.
care. I think it took away some of the stigma of doing less than all the things and made it okay to, in
Mhm.
fact, normalized it again, because it was, I mean, I started working in practices in 1985, and I saw my doctor have a client who had absolutely zero money, a puppy with parvo. It wasn't, a really hot case of parvo. And he sent them home and said, every 2 hours, give this dog chicken soup. It just needs to stay hydrated. Did the dog live? Yeah, it did. So those were the kind of things I kind of grew up in practice, seeing work and
Mhm.
seeing happen, and even talking to some of the insurance folks. There was a point in time where they were going to look at outcomes based on maybe some surgical cases that were done in general practice as opposed to ones done at the specialty hospital, and how did the animal present afterwards, and was it equal? And sometimes the answer is yes, it is.
Ah.
Yeah, it is. And sometimes even things like the limping dog cruciate repair, there's alternatives to surgery that you can try first and hope
Mhm.
that it works. And sometimes it does, and sometimes it doesn't. But at least you can try some things.
Yeah.
Um,
I think there are very few conditions where there is truly not more than one option.
yeah, yeah,
And honestly, even some of those, like, like GDV for me is kind of one of those where I'm like, yeah, it's kind of surgery or
yeah.
euthanasia.
You're
Um,
kind of stuck there.
but then I've also heard, in this, anecdotal stories of someone who, oh yeah, we were able to trocarize and flip the dog around and and it's like, okay, I mean, I'm probably not going to do that because that's, but like, oh my gosh, there is another option here.
Yeah.
Like some of it's just getting creative.
Uh-huh.
And it all comes down, like you said, it all comes down to that communication and telling the client like, hey, this is far from ideal.
Yeah.
And I've had sometimes where I've said to clients like, never done this before. I don't know if this is going to work, but if you want to try, I'm willing to.
Mm-hmm.
And I think and a lot of it comes down to that. Like, are we
Yeah.
willing to take that risk?
Yes.
And I think as long as we're having, I'm not promising the client that, treating this DKA as an outpatient, is going to work, but hey, sometimes it does.
Sometimes it does. Yeah. And in looking back and talking to people who are, like PLIT folks, the number one reason that uh, people get taken to the board and have complaints against them generally has nothing to do with medicine. It has to do with communication and the
Yeah.
lack of, and inappropriate or hiding from clients and not being forthright and forthcoming. So the other thing that you're teaching in teaching mentors how to teach their mentees is don't be afraid to be honest with your clients and openly say, I've never done this before. You're willing, I'm willing to do it. Because that way people feel like they're in partnership with you and you're not trying to hide anything. And that's
Yeah.
what people feel when people feel like you've done sneaky things and that you won't communicate and talk to them, that's when we get in trouble.
Yeah.
So yeah, sometimes you're going to have to say things that are uncomfortable.
Yeah.
And that's
And yeah. And there are sometimes where I say to people like, hey, with the state your pet is in, if we can't go, full bore and treat really aggressively, then that's okay. But then we really do need to think about euthanasia.
mm-hmm.
And I think that's one of the other things that I try to, always mention is, we think about spectrum of care as a way to decrease euthanasia for economic reasons. But that doesn't mean that euthanasia isn't still a valid treatment option. And sometimes it is the best fit.
It is the best.
And so I think I think sometimes I see that where people are so gung-ho about finding a way to help that we forget that sometimes helping is just relieving that suffering.
Mm-hmm. Yeah. Sometimes you just have to call it a day. And I can say that for my own pet, not Tucker. He's a young boy, but my last dog got Cushing's, and I was traveling all the time, doing a lot of speaking in 2018, and we tried him on medications. It was obvious it wasn't working, and it just came to the point that we said it's time. It's time to just give up. And there's no use of running more testing or doing anything else because he's miserable, we're miserable, and let's just relieve everybody's suffering because it is about that human animal bond. And you can do so much that it actually breaks the bond and it becomes an unhappy situation. And you're right, the euthanasia was absolutely the best option for Rocky, and we were all happier after it was over. We were sad and we missed him, but we were happier after it was over.
Yeah, there's definitely something to be said for caregiver burden. I treated one of my heart cat, we treated for lymphoma. And I'm so glad we did. We got a great year with him, but we chose a less aggressive treatment option because of my travel and his stress levels. And we got a lot of great time with him. And but at the same time, after we had made the decision to euthanize, all of a sudden it was like, I don't have to drive to the oncologist twice a month anymore. Like what I like, it, it was just this, I don't have to worry about medicating him. I can go out of town without stressing about, is he going to bite the cat sitter trying to give him medication?
Yeah.
And so, and that's, again, that's something where if we don't ask our clients, we're that there are some who will outright tell us, some people are just that forthright and honest, but the vast majority of people, may not say anything. And one of my goals is just, I don't want to ever make somebody feel guilty
Yes.
for what they did or what they chose not
Yeah.
to do.
Well, they feel, I mean, it's so easy to make somebody feel like they're a bad pet owner.
Mm-hmm.
And the choice of what we say, even a simple thing like your pet is overdue. This says, shame on you. Your pet
Mm-hmm.
is overdue, instead of we're concerned that he's not protected. And so
Yeah.
please come. It's a completely different way of saying things. But yes, to say to somebody, we don't want your life to be miserable. And it's
Mm-hmm.
okay. It is okay to let go. And
Yeah.
I feel like some people, and of course, like I said, I've been doing this a long time, and with some clients, they don't let go as soon as they should. And
Mm-hmm.
coaching that is very difficult too. I always will remember one client who had this 21-year-old cat who was completely recumbent, and she would bring it in on a pillow. And but she was like, oh, he's 21. I'm like, but he should have been only 20, because this cat's been miserable for a year and you won't let
Mm-hmm.
him go and his body won't give it up. But we just do the best we can every
Yeah.
single day, and then we have to let that go. And here it is 30 years later, and I still remember it.
Yeah.
We have
Oh
to
yeah. Oh yeah. There are some cases from like year one of practice that I still go back to, and I'm like, oh, I can't believe I did that. Or like, oh, how could I, like, yeah, I mean, yeah, there are cases that stick with us for sure.
there are.
And I think like a lot of the content that I end up, putting together a lot of times is, inspired by a certain case that either went really well or went really horribly.
Mhm.
And it's like, okay, what can I learn from this, and what can I teach other people
Yeah.
from this case?
Yeah. I mean, and I feel like that's such an important lesson. And as a mentor, to own your own mistakes
Mm-hmm.
and to say, I have screwed up. I mean, I used to teach class at about, talking about people in attendance and stuff like that. Look, I forgot to show up for work one Saturday. I mean, I was the boss and I forgot to show up for work. And I didn't try to pretend that it was intentional. I came back to work and went, I messed up. I
Mm-hmm.
just forgot, because I didn't usually work on Saturday. And you have to own that stuff. And then
Yeah.
people feel comfortable when they make a mistake coming to you, go, oh, I messed up. And then we take it and we learn from it and move on from that. So Kate, you made a choice to pull back from working full time in clinical practice. And that, I think, is kind of a hard decision, because there's that nice steady income. And then you think, oh, I'm going to teach, I'm going to write, I'm going to hope for the best, because I'm there too. I do the same thing. What advice would you give somebody who is like kind of thinking about, maybe they have an idea for
Mm-hmm.
something that would help the profession, or something that they want to do in their career, but it's a scary step? What advice would you give somebody?
I mean, that's a great question, because I feel like I've been doing this for 4 years and I'm still trying to figure it out. There's some times where, like right now I'm in a season where I've taken on probably more than I should have.
Mhm.
And, because there were just a lot of great opportunities. But at the same time, a number of them are unpaid. And so now I'm balancing the like, oh, I want to say yes to that thing that has a paycheck attached to it, but I really want to spend my time doing this volunteer work. And yeah, I mean, it's not an easy thing. I'm very fortunate that, I'm married, so we're a dual income household. And so I do, like, I have that support level. So I mean, I think the biggest thing to say is like, it's worth it to try. Because, you can always fall back on practice.
Mhm.
For a while, I started picking up relief shifts in the ER, partly because, I mean, after leaving ER and going to part-time GP, after about a year, I was like, I really miss it. like I miss the chaos.
Mm-hmm.
And so, I picked up I do once a month, I do an ER, urgent care relief. And part of that is just for the mental stimulation, but part of that is, financial,
Mm-hmm.
to help and say, okay, hey, this is going to cover, my student loan payment.
Mm-hmm.
So I think a lot of times it is that uncertainty that keeps people from doing it. When I was starting to look, even consider making the transition, I worked with a coach, and we set a like kind of a short-term goal of, hey, as a side hustle, you're still working full time. Let's set an income goal for the next 6 months, and I exceeded that. And it was like, okay, you know what, like it's there. Because for me, finances was the biggest thing that was keeping me, like you said, having that, steady paycheck.
Mm-hmm.
So I think, like, yeah, if you have the idea, like you can start while you're still in practice, and then as you figure out how much time it needs and what resources you need, you may find, hey, I need to pull back. Or you may be able to find a practice or go to your practice and say, hey, this is what I want to do. Is there a way that we can work that into, my work at the clinic?
Mm-hmm.
Like I said, I'm very fortunate to be an associate at a clinic that is very supportive of the work I do. And, when I'm like, hey, I need a week off to go to VMX, we're willing to, we have a way to work it out. Like, okay, well, we'll take these days off and I'll, adjust the schedule. And so I think a lot of it's just, put it out there, say what you want to do, and then just try it.
Yeah, absolutely. Well, um, how about the value of networking? I mean, do you feel that it's been really conducive to getting you where you are today in many
Absolutely.
different chapters?
Yeah. Yeah. I mean, for sure. And I mentioned earlier, like VBMA has had such ripple effects, and that's where a lot of my network started. And actually, when I was getting ready, like the way I got into speak, like some people ask me, like, well, how did you start speaking and writing? I'd love to do that too. And I'm like, well, I decided I wanted to do it. And I went to AVMA convention in 2018, and I literally walked around the exhibit hall telling everybody that's what I was going to do. I'm going to do speaking and writing. Now, the next question that they asked is, what do you want to speak and write about? And I'm like, I didn't think that far. I just want to do it. um, but at that, I had a friend and colleague of mine, her sister-in-law worked in industry, and she said, hey, she's going to be at convention this year. She does those things. Find her. I found her day one, told her kind of what I wanted to do. And she's like, okay, I have a friend who's an editor. Let me introduce you. I had written articles summarizing lectures at convention. So like before I flew home from convention, I had published articles on their website. And it was all, I mean, that was all networking, of just, reaching out to the right person who was able to make that connection. And, I'm fortunate now that I'm in that position where I'm able to make connections for people who want to get into that area now. So yeah, some of it was just literally just saying, hey, I want to do this. And then having the support and the network to put me in the places I needed to be.
It's really funny how the universe works. And sometimes it's just claiming it and saying, I want to do this. But I remember very well in 2000, I went to, at that time, it was NAVC conference. And I saw Karen Gavsner give a lecture. And I said, I think one day I'd like to do that. And little did I know that like 7 or 8 years later, that's what I would be doing, and that I'd been doing it ever since. So it's, I think the idea of, can I do it? Am I willing to do it? What will I have to learn to be able to do it? Because speaking and being a good speaker is a skill set that you can learn, and there's no reason you can't pick up a book and practice. And that's one of the things that I feel like has helped me a great deal, is just do it. And when people ask me, well, how do you get on the speaking circuit? I went, well, you're not going to walk into VMX the first week. You're not going to do that. But start locally, do your own staff meetings and give lecture in your own staff meetings, and start with people who know you and will support you. And then maybe you could go and speak at a local chamber of commerce meeting, or then you could go to the state VBMA and start doing those kind of things. But start with little steps, because when you go to the big stage and they
Mhm.
want to see what you've done, because they don't want you to
Right.
get there and fall on your face because you fainted in front of a 500 person audience, right?
Yeah.
Yeah. Um, so tell us a fun fact about you, Kate. What do you do for fun? Do you have a secret
Um,
talent?
I don't know about talent. I enjoy running, which gosh, until like, I mean, that's really been something that's developed like in the last 10 years. Like I don't think I'd ever even run a full mile until like 9 years ago. But so I do distance races at Disney World about every 18 months. So I actually just got back from one the beginning of April. It was the first time I did a multi-day race. So it was a 5K on Friday, a 10K on Saturday, and a 10 miler on Sunday.
Oh gosh,
So it
Kate.
was 19.3 miles over 3 days, plus all the time, spent in the parks afterwards. And I honestly was not sure because I was coming off of a cold and a knee injury and a whole bunch of other chaos. And I was like, I'm not sure I'm actually going to finish all the races, but I'm going to at least start them. And I did it. So I'm now under strict orders from PT, from my physical therapist, not to run for a little while we get my knee sorted out. But it's like, I mean, I can still run, right, for these races. And they were like, you can if you can tolerate it.
Yeah.
So, got through those, did a lot of walking, but got them done. So that's one of my like, I'm a Disney adult, I think was what
Yes.
they call them.
Yep.
But my husband has said he's like, you can run a half marathon other places than Disney. And I'm like, I like running. I don't like running that much. If I'm gonna run 13 miles, it's gonna be somewhere fun. And it is an excuse to, regularly go to Disney
Go to
World.
Disney.
My 5-year-old has yet to be at Disney World, but I
Oh,
have gone multiple times in his life.
how about that? Well, my niece is actually a travel agent with Travelmation, and her specialty is Disney travel.
Mhm.
And so she goes all the time. And she just took her 4-year-old little girl for the first time. And they did 4 days of princesses and rides. And I had not been to Disney until last VMX. When I saw you there, the VBMA,
Yeah.
I spoke to the Alumni Association. The next day we went to Disney, and I rode the ride to Mount Everest, and not knowing that it would ride you backwards at 50 miles an hour and change direction. And I don't do roller coasters normally, and I really did not know that it did that. And my husband's like, "Are you going to be okay?" And I'm like, "I'm fine, I'm fine, I'm fine." Back it up. And then I get off and went, "Okay, I've done that, and I'm never doing it again."
Yeah, and then when I was at Disney in April, we definitely rode that one back to back like several times.
Oh my gosh, no. Now the Banshee ride, I would have done it continuously. That was so much
Yes.
fun. That was a lot of
Yeah.
well, Kate, thank you very much for joining us today. And anything you would like to say about yourself or how people can get in contact with you, we will put information in the show notes so that people have your website information. But anything you want to say about Right the Boat?
Yeah, so I mean on Instagram it's Write WRITE the boat. And that's also the website writetheboat.com. That's the kind of the best place to stay up to date on, new things. The manual lives there. Working on some new spectrum. I'm always working on something new. So working on some new spectrum of care and mentorship things. So I mean, I love connecting with people. So, reach out and have a conversation.
Yeah. And you have a good newsletter, because I am signed up for your newsletter. So I get that. Yeah. Okay.
Yes, in theory it's weekly.
I understand.
Sometimes it's every other week,
Yeah.
but I try to get at least a couple out a month.
Yes, I understand. Yes, I'm a couple of blogs behind myself, and I'm trying to work on them, but sometimes life gets in the way, and you have to give yourself permission to go. It will be okay. I will do
Yes.
it. It'll come, and nobody's paying attention to it really, but me. And it's not really coming
Yeah.
out. Everybody else is like, oh, it showed up in my inbox. This is good. I'll read Kate's newsletter today.
Right, right.
Well, thank you once again, Dr. Kate Boatright, for joining us today on The Bend. And thank you to the audience for spending your time with us today. Again, I'm Debbie Boone, your host, and I look forward to seeing you the next time on the next episode of The Bend.